Don't know when else I'm going to gravitate towards brown earrings other than when I'm wearing a brown shirt, so make use of it. Hey future and fellow OTs, welcome back to my channel. I'm Thalia and I'm an occupational therapist. In today's video, we're going to be talking more about job interviews. I have already made one video on job interviews, which I'll link up here in the cards and down below. That was more around the different types of job interviews that you might expect to encounter on your job journey, career, adventure that's kind of lifelong usually. And I think I also gave some tips in that one as well about a mindset to have going into job interviews. So I definitely recommend checking out that video before or after this one. Order doesn't matter to me, but I hope you enjoy them both. In today's video, we're going to be talking more specifically about questions you might get asked, questions I've been asked, questions I've heard friends get asked in job interviews. We're also going to be talking about tips when answering the questions. Now, I'm not going to tell you how to answer the questions because that's ultimately up to you and your clinical experiences, how you answer the questions. We're also going to talk about things to prepare for the interviews, just to have ready to go, things to physically bring to the interview. We're also going to be talking about things that if you're a student at the moment, you can be thinking about and recording right now to start preparing for your job interviews. If they're this year, if they're next year, just start thinking about and taking note of a few things. But before we get into the video, don't forget to subscribe, hit that like button, and consider following me on Instagram. It's at endless.education. But let's jump in. So the first thing we're going to go through is some examples of questions you may get asked. And so I might recommend preparing for, just thinking out loud, how you might approach the question, just so you're prepared in case it comes up. So my interviews have been in, just to kind of give you a background, pediatrics and mental health space, I think predominantly. I don't think I interviewed or applied for any jobs outside of those two specialties. I take my experience with that kind of lens, just in case you're applying for a different area. There might be some questions that are more specific to this specialty, but think about what would be the example in your specialty. So replace the child with the older adult, or think about the intervention instead of a specific pediatric intervention, say make it hand therapy. Just see how you can kind of fit it to what job you're applying for. So the first question that I've been asked multiple times is to talk about, give an example of a time you've been in an ethical situation, whether it's been with the client/patients or whether it's been with staff. And I personally had, it seemed to go pretty well in most interviews, an example from when I was on placement with another student, kind of dealing with different styles of work ethic and how I worked through that situation, the things I tried, and it kind of showed that, you know, I didn't run for help straight away. I kind of tried to work through it myself, and then where it was appropriate to do so in the situation, and then I sought help from a supervisor of how to continue or deal with the situation. So it was a bit of a journey I went on, and I've shared a few times now in interviews, and they seem to always be quite receptive, and I feel like I have got the specific feedback of I really liked your example in the interview, know how to deal with ethical situations, so that example has worked well. The next example I have gotten in different ways in different interviews for different fields. So the pediatric example might be, how would you handle a situation where a child's dysregulated, they've run out of the classroom, what do you do? Or for mental health and an inpatient, so hospital setting, how would you handle a patient coming down the hallway who is fluidly psychotic on the ward? What would you do? Also, how would you just handle in general conflict? Usually it means with other staff members, other OTs, if it's a multidisciplinary or interdisciplinary team, the nursing staff, the doctors, how would you handle conflict? So have a think about that. Now, these are in no particular order, by the way. The next one is, why are you interested in this position? Why have you applied for this particular job with this company in this location? Have a think about your whys. I've also been asked, how will you integrate evidence-based practice into your work? So having a think about evidence-based practice, there's a few things to think about, and I'll put them on the screen. How do you integrate evidence-based practice? You can be thinking of examples from placement. You can be thinking of the things you've learnt at uni and how that's really encouraged you to adopt to make sure you're using evidence-based practice. Have a think. Now the classic, what are your strengths and weaknesses? That can come up as well. So make sure you have a few strengths and a few weaknesses and talk about how you're working on them, or how sometimes your strengths can be weaknesses, and a big thing to show is that you've reflected on your practice, on yourself. That's a big thing that employers might be looking for. A question I've been asked is, what's a time when you've messed up? It's inevitable that we're all going to mess up. We'll mess up throughout our career journeys as we get more knowledgeable and more confident. Things happen, we mess up. They're looking at how did you deal with it? It's going to happen. How did you deal with it? Did you ask for help? Did you try to hide it, brush it under the rug? Did you kind of, laugh about it and keep going? Did you go home and cry and never come back to work, or never go back to placement? Did you quit? What happened? They want to see a good example of how you handle a situation where you've made a mistake. Were you ethical? Were you trustworthy? Were you reliable? All the personality traits that are positive that an employer is looking for. Have a think about a time, a story that really can demonstrate and showcase the best employee that you can be for them. An example of when you've worked in a team, hopefully with our uni course, we did so much group work that there was many examples. I've been asked, what's a possible advantage or disadvantage of working in a multidisciplinary team? You may be given case studies to read beforehand or read on the spot, read through. You might be asked, what's your first step? After reading this, what's the first thing you want to do? What's the first bit of information you want to gather? Or just in general, what sort of information would you like to gather? Or what would be your plan moving forward? So it might be specific to the first step, or it might just be, give me an overview of your plan right now with the information you have. So I've had the experience of doing a telephone interview because I was a few hours away from the destination of where the job was. So I wasn't able to get there easy, so we did it over the phone. They emailed me the questions. I had 5 questions, 10 minutes. It was not enough time to read through multiple scenarios, and that's how I answered it. And I think in another one I've been given on a piece of paper the scenario when it was in person outside the room, or maybe it's a week in advance you'll get sent a scenario, something like that. So it can be a bit different in how much time you're given to prepare. Another big question is, how do you practice cultural responsiveness? Now this was definitely something we talked a bit about and learnt more about in our university course. And so for example, we had fieldworks, or some of us had our 10-week block placements in working with Indigenous populations, with cold groups, culturally and linguistically diverse groups as well. So those can be great placements to really find perfect examples, great examples that showcase you. But if you didn't have that particular placement or opportunity, have a think about how you can be culturally responsive to different populations that might be more present at the job. So if you know in advance about if there's a particular cultural group that's more likely to be in your client base at that job the job you're applying for, it could be a time to kind of look into and consider, how can I be making sure I'm culturally responsive? Am I always going to make sure to ask if they need interpreter or translation services? Am I going to offer more visuals to language-based resources? Have a think, because there's lots of different ways we can be culturally responsive. And one of the biggest ways is just acknowledging that we're not going to know the lived experience of the culture, the history, the background of the clients coming to see us. Have a think about the frameworks that are most commonly used in the field you're applying for. For example, in adult mental health, I often get asked, how do you incorporate the recovery framework? How do you utilize trauma-informed care, which might be in pediatrics, mental health as well. Have a think of examples where you've utilized, or you hypothetically can utilize, the framework that usually gets used in the field you're applying for. What do you think contributes to a good workplace culture? What do you look for in a good colleague? What makes a good colleague? What makes a good team? Those sorts of questions. So that's my list of questions today for you to go away and have a think of. Think of how you might answer them. Think of a clinical scenario that might come up in your field. If I didn't mention anything relevant to you for the case examples, how would you handle if this person was on the ward? Or how would you handle if the medical team wanted to discharge, but because of the safety of the patient, because of certain risks, you didn't believe it was safe to do so? How would you handle that situation? Try and think of situations that can be a bit conflictual or just difficult situations, whether it's a client, a team-based scenario that might come up in the specialty you're applying for. Have a think of ways you might address those issues, ways in the past that you could draw on as examples. Well, this is how I approach it, and it reminds me of this situation where I actually went through something similar. This is what I did there. I might also in this situation do this or do this differently. Try and always draw on examples. It can be really helpful to illustrate your answers. All right, so just a couple little tips for when answering your questions. It's okay to ask to hear the question again, especially if it's a multi-part question, because they can come up a lot. It can be like, what would you consider, this is just totally making it up, they won't necessarily ask you this, what would you consider the diagnosis? What would your first plan of action be? What other health professionals would you like involved? And in what time frame do you think they should be discharged? Like, there can just be lots of things, and you might be going one at a time in your head, and you might just ask them, is it okay if you repeat the question again? You might want to bring in a piece of paper if you're allowed to, write it down. Okay, so to address the first part of your question, sorry, what was the second part? Was it this? That's right. Okay, this is my answer. So it's okay. We're all human. When we get those multi-part questions, it can feel like, oh, I wish this was in written form that I could hold in front of me. Sometimes I've had some interviews do give you these questions like the case scenarios I mentioned on paper beforehand, so that can help bring that in. If you've had time to jot down notes, bring that in with you. It's okay to reference it. Make use of it if you get that opportunity. Also, if you need to clarify the meaning of a question, try and do it in a positive tone of voice rather than sounding really unsure of what's going on. Sorry, did you mean, by asking that question, did you mean this? Okay, great. So that's what I'm thinking through. So I'm just wanting to check I'm understanding the question. It's this. Would you say you're meaning this? So instead of, oh, what? That question you just asked, did you mean this? I don't know if that was good acting or not, but maybe that demonstrated unsure versus like confident, a bit more confident, a bit more positive in my ability to answer the question. Just wanting to double check, you know, I've got this, but just want to double check. Another tip, which kind of refers back to one of the questions around frameworks, is try and use models, examples of models where appropriate, in your clinical answers. So it might be, you might want to draw the PEO model if you're answering a clinical question where it's relevant. You might want to talk through the MOHO if you're working in mental health. You might want to talk through the CMOP, and considering the CMOP and considering spirituality, or going through, you might just want to pop in, you're like, yeah, I know my models, I know my theory, and I attach my theory to my practice, and I just walk out into the world as a free agent, you know, I refer back to theory so I know I'm on the right page. That could be another opportunity. So try and slide in models where appropriate. Doesn't mean what your strengths and weaknesses. Well, considering the PEO, I'm a great, yeah, we don't have to do that, it's okay. All right, now on to some things to prepare in advance, apart from practicing those questions. And make sure you Google interview questions, because those random ones, you know, what animal are you, can come up as well. But these are some things just to prepare in general for most job interviews. So know the values of the company, the organization, the school, the hospital, because that's a pretty classic question that might get asked. It might be asked like, do you know our values? If you were to pick 2 or 3 values, which ones kind of align most with you? Can you give us an example of a time you were each of the values, if there's a few or a few of the values? know the values. Try and know the history, if it's like a newer company or a newer school, the motto, the vision. Read through the website. Just show them that you've done at least the bare minimum research of looking at their website, please. It will really help you with those types of questions. And along with that is show that you've taken that time to research, to read, to understand the organization and how it aligns with your own values and how it aligns with what you're looking for in a role. Know your resume. If you've submitted a CV or resume, which you usually do, know what was on it. So know, oh, I saw you were in the swim team that year. I saw you volunteered at that. What was that like? Know your resume. Don't be like, oh, when was that? Oh geez, that's a long time ago. Well, sounds like something I'd like. Know what you gained from that experience, that award, how you got there, all those sorts of things, because you shouldn't be putting things on the resume that aren't relevant. So make sure everything that's on there is actually relevant and important to showcase who you are to the employer. Know your strengths and the areas you would like to improve. So make sure you know going into it that I haven't had experience, say, in mental health, so I've already started doing this to improve my knowledge. I've shadowed, I've researched, I'm reading this book, I'm listening to this podcast, I'm watching this movie. Show them all the things you're already doing for the areas you'd like to improve on, and just that insight into the areas you need to improve on is a big deal, and knowing examples of your strengths like we talked about before in the examples of questions. Have those examples of where you're showing a growth mindset rather than a fixed mindset, and examples of where you've overcome challenges. So similarly to knowing what areas you'd like to improve on, make sure you're talking about how and demonstrating how you have a growth mindset. I can't do it yet, but I am doing this. Not, I'll never be able to do it because I can't do it now. That's more the fixed mindset. I can't do it yet. So that yet word is the biggest part of growth mindset to me. Neuroplasticity, our brains can grow, they can stretch, we can learn new things. So I often say to the kids I'm working with when we're learning about growth mindset, when you were born, you didn't know how to walk, did you? Oh, but you can walk now. Okay, so how did that happen? Oh, we learned how to walk, lots and lots and lots of practice till we got it right, and now it's really easy. But what would have happened if we'd said, oh, I can't do it, I can't just walk. We might just be rolling around like a potato or something. So like, just being a bit silly with the kids. But growth mindset is just as important for us as it is for the kids we work with. So make sure you're demonstrating that you have that mindset. You don't need to label it necessarily, maybe you might. Some employers would probably know growth mindset, but it's something to try and put forward when you're answering your questions. Have examples of how you've successfully worked in teams and successfully worked independently, because both of those are different skills that employers usually are looking for. Okay, so next I'm just going to talk about a couple things, so not very much, that you can bring to your interview that are helpful to have with you. First one is copies of your CV/resume, copies of your written response. If you're asked to select a written response to the selection criteria, answer these questions prior to, because they might reference it. And sometimes it's helpful for them to say, oh, if they say, oh, I remember something about this on your resume, and you'd be like, yep, this one, I got it right here for you. Here's a copy. Don't worry, I brought two. Oh, I really like that example you gave in your written response. It was around, oh, do you mean this one? Is that what, yep. So you have those ready just in case. I also like to have a list of questions, whether it's written down or it's in your head. I write them down. I'm a bit like goofy about, so I have some questions. Do you mind if I just whip them out? Yep, okay, so let's go through them so I'm not pressuring myself to try and remember them all. Probably would have been able to kind of list them off without having them there, but I kind of want to write down the answers sometimes as well, so it's helpful to have them maybe in a little notebook, and it shows them that you really thought about and prepared for this job. Like, oh wow, she does have questions, she's written them down, she's serious about these questions. So some questions, I think I might have gone into it in my other video, but an example might be, how is this role I'm applying for going to help the workplace? Like, what is it filling a need at the moment? And an accompanying question that I might ask before that is, what are the biggest challenges facing the organization, this school, this hospital, this team at the moment. So it might be staffing, it might be limited resources, it might be like a condition that's new and they're trying to like upskill really quick. And then you can ask about, is my position hopefully going to help with that challenge, or how is my position going to help the company grow? Just those sorts of questions. And then other questions that are more practical, like how many hours of supervision, or can I go do PD, will I be supported, blah blah blah, all these things. Because remember, like I said in the other video, you're interviewing them as well, so you want to figure out if this job fits with your values, fits with your needs, not just them figuring out if you fit for them. It's two ways, so always remember that. So now onto how you as an OT student, or even a clinician who's graduated, can start preparing for job interviews in the future. So start thinking of stories or narratives from your placement experiences that can exemplify all the questions or all the other qualities we talked about today. Prepare descriptions of your achievements, whether it's projects you've done, whether it's volunteer experience, if it's awards, if it's client outcomes. Try and write down, jot down, thinking back over past placements or projects, what you achieved, how you might summarize that, and have a think about what qualities or skills that is a great example of. And usually in a good story you can get a bunch of different kind of examples of skills, like presenting, group work, managing conflict, computer skill. Like, you can usually get a few things out of a good story. Try and write some case examples and written reflections linking theory to practice, and this is a good time to be articulating your knowledge of OT models and frames of reference. Making sure you're making good relationships with your colleagues on placements, or colleagues now in your jobs, because they're usually going to be future references, and they might be reporting on your ability to communicate clearly, succinctly, and with respect, and all the other selection criteria they may be asking referees when they call them. And just making sure that you're demonstrating overall professionalism, reliability, trustworthiness during your placements or interviews, because again, referee calls, but they also can do referee calls, letters, and reports. So really making sure that you're taking your placements seriously, not too seriously that you're not getting enough sleep, but making sure you're being professional, all those things, trustworthy, reliable, all the words I've said, conscientious, because it's usually your clinical educators that are going to be your first referees. If you're coming out of uni, it might be your part-time work, your manager or employer there might be a referee for you as well. So just making sure you're being professional, and I keep saying the same words over and over, reliable, trustworthy, on top of your stuff, ask for help, but gives it a go first, all these things. Okay guys, that's the video for today. I hope you found this helpful. Let me know down below if it was helpful. If you have any additional questions, let me know. Make sure you like the video. Follow me on Instagram. It's at endless.education. Consider subscribing, and I'll see you in the next one. Bye guys.